Without social distancing, we will cause the spread of virus even more rapidly. If social distancing is done correctly and on a large scale, it helps to break or slow the chain of transmission from person to person. This was clearly proved in the analysis done by University of Washington Health Index and Evaluation Center IHME in 2020. Analysis of the epidemic situation in 7 lockdown cities in Wuhan, Italy, and Spain showed that maintaining social distancing really achieved results. Besides, this was also supported by the study done by Erin Mordecai and his team of biologists at Stanford University. They demonstrated the role of social distancing in epidemic control by developing an interactive simulator to simulate the spread of COVID-19 over time. Notably, the government quickly adopted the correct strategy, thus controlling the rate of the increase of cases and winning more time for doctors. If this had not been the case, it would have been impossible for medical staff from another province to go to Wuhan for support, and Wuhan appeared to be the only outbreak city. There were 50,633 confirmed cases in Hubei on February 18, 2020 because of a peak after the closure of the city. Then, the number of cases began to decline. As of April 13, the number of confirmed cases in Hubei province was 244. This again shows the effectiveness of social distancing in controlling the spread of COVID-19. Without social distancing, we may experience shortage of medical supply. The rapidly increased cases of COVID-19 have shown to be overburden the healthcare system in the early stage of the outbreak. Besides, this epidemic situation also delayed the hospitalization of non-COVID-19 patients, especially those who were in critical condition. Studies showed that the daily shortage of ICU beds for critical COVID-19 patients remained at the level of 100 beds during the entire first wave of outbreak when the government adopted the social distancing and lockdown strategy. In addition, social distancing also saved medical resources such as masks, hand sanitizers, and alcohol-based disinfectants. Other than the medical costs, we should also focus on healthcare workers who risk their lives and time to help people. Imagine yourself as a healthcare provider or even their family member. They work day to night and sacrifice their rest time for the people who need them. They're eagerly waiting to go home and reunite with their family members. So, stop being selfish and be disciplined so that we can all fight the deadly COVID-19 together. The way novel COVID-19 is transmitted means that taking certain social distance measures is the most effective practice to prevent and control the disease. WHO's Southeast Asia Region Director Poonam Khetrapal Singh found that we could reduce the virus transmission by following social distancing measures. The spread of this disaster is global. To fight the epidemic, people from all countries need to unite to see the coming of hope.